a warm welcome on behalf of all the members of the GOVTRUST Center of Excellence. My name is Esther van Zimmeren, and together with Koen Verhoest, who you will see after me with a more detailed explanation of what GOVTRUST is about. So I'm a coordinator and I'm a professor in law at the University of Antwerp. So, GOVTRUST is a kind of a unique collaboration dedicated to research on trust and distrust within the context of multi-level governance. And we gathered researchers from 5 different disciplines. So political science, public administration, also communication science, behavioral economics, and of course law. We basically started, or the center got established in January 2020. Some of our members joined a little bit later. And so you can imagine that starting in the beginning of 2020 was not an easy thing to do, trying to connect people, and then of course also in the environment that we're having. But at the same time, it was a very fascinating moment for researchers who are interested in doing research in trust and distrust, because of course, all the measures that were taken are very strongly linked, especially in terms of their compliance with trust in government, trust in mass media. And so though it wasn't always easy to carry out the research and to actually collaborate at a distance, it has been a very fruitful in terms of the research that we have been doing. And so this first GOVTRUST consortium or symposium meeting, we hope to do it every year. This one will be online. We will see in the future whether we will keep it online, but we're very happy that we can gather so many people at this occasion of the first annual meeting. And so our objective is to present ongoing research of the center, but definitely in combination also with the research of other researchers in the same field, in the field of trust and multi-level governance, and of course the corona crisis and the measures that have been taken in that context. So before we start with some more content, I have a few practical things that I want to discuss. So important to know that the symposium is being recorded and also will be made available afterwards. You can use the chat function if you have questions. But if we have a discussion, maybe it's also nice to put your camera on and to use the microphone so we have a little bit more of a dynamic. We have relatively strict time frame for our speakers, so we want to invite the speakers to really stick to the time so that we also have some time for discussion and of course also for our discussants to interact. Also, unfortunately, at the end of our symposium, we had foreseen also reflections by Wim Voermans, but he's ill. So we will try to make up for his absence, and Koen Verhoest will then step in and come up with some more substantive reflections on the different panels, and of course also on the keynote speaker. And so I think we can now then move on to the presentation of Koen Verhoest. So Koen Verhoest is the main promoter of the GOVTRUST Center of Excellence, and also a coordinator. And so he is a member of the research group on politics and public administration from the University of Antwerp. What is also interesting to know, there's a very interesting Horizon 2020 project going on, the TIGRE project, that he will also talk a little bit about. And we are happy to see also, of course, some colleagues from the TIGRE project participating today. And of course, Koen is also known for a book that he published together with Frederike Six on trust and regulatory regimes. So Koen, please go ahead, you have the floor.
Hello, can you hear me?
Yes, hello? We can hear you very well.
Okay, great. Welcome everybody, thanks for participating. There are 150 people registered for today, but I guess more will be joining later. I will briefly present to you what GOVTRUST is actually about. So what is our focus? What do we plan to do? Who are we? What are we working on, at least in 2020? Okay, so this is the first slide. Hopefully it works now. So the GOVTRUST Center of Excellence will be presented to you. And GOVTRUST is basically focusing on a general trend, which is proclaimed to be happening, that trust in our institution is decreasing in long term. And here you see a picture of Brexiteers who voted to leave the European Union, certainly partially because they have low trust in the European institutions. And if you see over time, the trust in European institutions, there's indeed a declining trend, although there are some hiccups, but the trust in the European Union, Parliament, Commission, and the Central Bank is clearly decreasing. Same things are apparently happening for national governments and for local governments to some extent. And it's said that even the pandemic is adding to this kind of decreasing trust, although we will nuance this today in several presentations. There's also the idea that it's not only trust in government which actually is decreasing, but more general in our societal institutions, like in mass media. People are actually distrusting government, but it also relates to distrust in societal sectors, which are regulated and supervised by government with rules and with enforcement. For example, since the banking crisis, the trust in the banks did not recover fully, at least according to this heading of the report. And also the trust in food safety is actually declining over time. The trust of people in these sectors, of course, relates to how they see government functioning in the way it steers society and regulates sectors. And for example, this heading shows that sometimes citizens' trust is low, decreasing because they perceive the relationship between the government and the regulators within government with the regulated sector as being too close. On the other hand, it's for a citizen to trust a regulatory regime or a regime which makes policy, it's important that also within this regime, different actors work well together. And for example, this example of politicians who trust the EFSA shows to this. What are we then actually focusing upon is the idea that multi-level governance systems, when they need to be trusted by citizens, citizens need to trust the interplay of the different actors in these different levels of government which are involved. And the interplay between politicians, administrations, regulatory bodies, if it's about regulatory policy, and judicial actors is conditioned also by the extent of trust between them, between these actors. And this is actually something which happens within a governmental level, but also across governmental levels. Certainly for some regulated sectors like food safety or telecommunication, or a lot of other sectors like environmental policy, there's a lot of interaction between the levels. And basically policies and regulations are made jointly and implemented partially jointly by actors in these different levels. So we focus on how citizens, if they want to trust certain societal sectors, they need to trust the government and the interplay of these actors within government. And therefore, our assumption is that there needs to be a certain amount of trust within these governmental levels, between these actors, to actually deliver well and to be trusted by government. And of course, media plays a role. So trust is important, but things are indeed a bit complicated. It's multi-actor. Trust of citizens in the multi-level government systems depends on the trust relationships between political, administrative, regulatory, and judicial actors within these systems. And our second point is that trust matters, but also distrust matters. And in our conceptualization, which borrows strongly from others, like Burkhardt and Olmsels, we focus on actually the functional balance of trust and distrust. The idea is that too much trust can be dysfunctional, so there is some kind of optimal level of trust, and also too much distrust is dysfunctional because it basically blocks cooperation. But in some relationships, a certain amount of distrust might create enough vigilance of actors to monitor what is happening, and is needed in some relations within government, but also some relations of government with the private sector, for example, a regulator which regulates food producers. The third point that we take along is, again, borrowing from a lot of authors, is how trust is built over time. You build trust through interactions with other persons, with organizations, but also because you trust the rules of these organizations and the rules in the regimes. But trust can also be depleted very quickly, and then trust needs to be restored by certain processes. We try to see how trust and distrust patterns evolve over time and how trust can be restored. The fourth thing that we take along is that basically, if you trust the multi-level governance system, you can trust a civil servant with whom you are interacting at a certain level. If you interact enough, you can start to trust the organization behind the civil servant, or you can even trust the whole system behind it. Or the other way around is if you trust the institutional rules and norms of certain organizations and the government systems, you will have some kind of basic trust in the person who's actually representing these organizations and government systems. But all these levels of trustees, persons, organizations, and systems interact with each other and can actually reinforce each other or undermine each other. And that brings in an interesting element in terms of how trust is built and how trust is restored. So our focus is multi-level governance. So the idea that public actors and at different levels of government interact with private actors and their interests to build policy, to build regulations. But we look to regulatory settings, but we also look at collaborative settings where new policies are made, where new services are made, where services are implemented jointly, and also other settings. We look at our focus mainly actor relations. So we try to conceive how trust is built in actor relations. And we look at patterns of trust and distrust in relation to how legitimacy is built, how it relates to legal certainty, to reputation of public organizations, private organizations, how transparent they are, the accountability regimes, and so on. So it's a rather broad research agenda. And basically, we want, of course, like all scientists, we want to contribute to knowledge of the dynamics, but also the causes and the effects of trust and distrust in such complex governance systems. And we try to do this by combining methods and insights from different disciplines, as Esther already told you. So we try to use quantitative methods, surveys, experimental methods, survey experiments, but also field experiments, but also qualitative methods like QSORT, and in-between methods like QCA, which are combining or looking at different cases at the same time. Also social network analysis, for example. So we combine insights or knowledge from 4 research groups, from 3 faculties, and 5 different disciplines. And of course, we seek to have scientific and societal impact. To go a bit more in detail, so basically GOVTRUST is some kind of consortium which is developing a research program in which we want to strengthen conceptual development of trust, distrust, processes of trust, but also related concepts. We want to theoretically advance the knowledge of trust building, the relationship between trust and distrust balances, and trust restoration at interpersonal, organizational, and regime level. We want to do this by combining methods in mixed methods research, And of course, we want to have implications for policies and societies. So we will have policy briefs, but also dialogues with practitioners. And what are the content or the foci that we built this research program on? Is on the one hand, one research track is looking at these frontline interactions between citizens or a regulatee with a public servant, physical, but also online context, to see how actually trust is built in such context and how it actually is affected by the trust one has in the government organization behind this interaction, or how it actually helps to build up trust towards government in general. So this idea of different levels of trustees is very much into that research track. The second research track is basically the idea of restoring trust. Is often done by delegation arrangements. For example, after the crisis in the financial sector, at the European level, there was a creation of autonomous regulatory agencies, 3 of them, which needed to help to rebuild trust. And we are looking to such kind of delegation arrangements. Could also be decentralization to local level, or hiving of tasks to societal actors. A third research track actually looks to the interpersonal relationships which are building up in negotiation platforms, which bring together people from different governmental levels and private actors. For example, networks where new services are built or new policies are made. This idea of collaborative innovation, how does actually trust works in these interactions and distrust works in the interactions. And the third or the fourth research track is more looking at the use of distrust creation as some kind of political tool, a contestation strategy to bring certain actors into discredit and to strengthen your own political position. For example, in international trade, non-profit organizations actually create distrust in trade agreements, which then brings a new dynamic of policy change. Consortium has been already briefly presented by Esther. So Esther and Sophia and I are involved in coordination. There are 5 promoters and 4 research groups. So there's the research group of politics and public governance, and also Peter Bursens is involved there. He's from social sciences. Government and law, it's public law, it's Patricia Poppelier. The communication science is brought in by Michel Bauerave and his team in NIOS. And Caroline de Klerk brings in from the Faculty of Business and Economics, the behavioral economics part. We have an academic core group from the 4 research groups, which consists now of 14 professors and postdocs. We have an international scientific advisory board, of whom we are very proud, and that consists of high esteemed members like Per Legret, who is present here from the University of Bergen, Matthew Flinders from the University of Sheffield, David Levy-Fowler from the University of the Hebrew University of Jerusalem, who is also present, Colin Scott from UCD, Yacine Jordana from eBay. Yacine, glad that you're here. Christopher Lord from Arena, Bas Denters from Twente, Paul Hart from Utrecht, Graham Hodge from Monash Law School, Australia, Erik Hans Klein from Erasmus Rotterdam, and Wim Voermans from Leiden, who is unfortunately ill. What have we been doing? So we have some numbers here. We invested a lot of time in submitting projects this year. Most of them are still in evaluation. We had some luck, we had some less luck with some proposals, but you see the funders there. So it's national, international, fundamental, policy oriented. You see the partners with whom we are working. And we have already started to build up some output, some publications. We have invested in media outreach, of course, also because of the COVID-19 crisis. And we had some events and activities. Maybe I will use the remaining 3 minutes to present some projects that we are strongly involved in and which are really nice collaborative efforts. So the TIGRE project, which is led by Yanis Papadopoulos and Martino Maghetti, and also David is involved, and Jacinth is involved, studies basically how in regulatory regimes trust relations exist between actors in regulatory regimes and how this influences trust by citizens. We focus on financial sector, food safety and data protection, and we use surveys, social network analysis, qualitative research, media analysis, and different methods. Then there's a second project which is led by KU Leuven, Kromfoods, and which basically looks at how big data, artificial intelligence, and blockchain is used in the federal government here. It's funded by the federal government. And we have a work package on how, with experiments and focus groups, how, under what conditions citizens and partners trust the use of big data and artificial intelligence by government to make decisions in terms of access and social security, which are our empirical domains. We hope to present you some results next year. And then what we have been also investing a lot in this year is, of course, the bad luck of COVID created also some opportunities for research. So we had a BOF project which focused on trust and relates to the legitimacy and intended compliance with COVID-19 measures. And it looks at conditions which makes that measures of COVID-19 are socially legitimate, legally sound, and stimulate compliance. There will be more said about this later, so I won't talk too much about this, but it's basically a combination of survey, experimental approach, and legal analysis. And this is to show you how data was gathered during the Corona crisis. So basically we hooked onto a bigger survey, which was set up in March at the University of Antwerp together with other universities. And at first it was weekly and then 2 weekly. And we managed from April onwards to get a battery of trust questions in there about trust in governments, but also about effectiveness and appropriateness of measures and risk perception and so on. And this was basically done 7 times. And you see how it relates with the peaks we had in the COVID-19 crisis. We had 2 peaks, one in spring last year and one in autumn. And also you see an experiment mentioned there, that's the BOF project on which Patricia will tell more. But at least it gives you an idea of the kind of data that was gathered across the period and shows already some kind of evolution of trust in the federal government and trust in the EU. So the red dotted line is trust in the federal government. You see an initial rise, then a decline, and then a rise again. And trust in the EU also evolved in another way. This will be discussed in the second session also, because Peter will discuss about how trust in different levels relate to each other and how we could make an interpretation of that. So this is basically my presentation. I hope I stick within the time more or less. So I will stop sharing and give the floor back.
I think you did an excellent job there in terms of sticking to the time. Thank you for that. So now we move to our keynote session with Professor Benjamin van Rooij. So I hope you can see my screen for a second again. So I will be short in terms of the introduction of all our excellent speakers. They have a wonderful track record. If you want to see more of the details, you can also go to our website where you can click on the link and go to the website of each of the speakers. But just as a short introduction, so Benjamin van Rooij, he's the faculty director of research and professor of law and society at the University of Amsterdam, also a global professor of law at the University of California, Irvine. And so he has worked a lot on law and behavior, compliance with and regulations in different fields, but has lately obviously focused also on compliance with Corona measures. And that's what he will be discussing also today. So for the audience, maybe Benjamin can start sharing his screen. For the audience, if you hear a strange signal, at about towards the end of presentations. So this is just to indicate to the speaker that they have 5 more minutes, and then there's another signal towards the end, just for timekeeping reasons. So don't be worried if you hear some sounds which are coming from Sophie op de Beek. So without further ado, I would like to now pass on the floor to Professor Benjamin van Rooij.
Thank you so much.
Yeah, we can hear you well, and we can also see the presentation.
Great.
So.
It's wonderful to be here at the first annual GovTrust conference. It's great to also see so many colleagues here. It's a pity, obviously, we can't really be together. So I look forward to the second annual GovTrust conference where I can actually see you in person, I hope. So as many of us, also my research group, the Center for Law and Behavior, CLAB in Amsterdam, all the colleagues that I work with are listed below, and also some of the colleagues abroad and from other institutions. We've been interested in what has happened with the outbreak of the COVID-19 virus for what it means for regulation. My own focus in studying regulation, it's not the only one, but a core focus has been really at the behavioral level, understanding what makes, if we try and regulate a risky behavior, what makes that regulation in the end come to shape human and organizational conduct. So what is unique, I think, about the COVID-19 situation is the global directed governmental, also non-governmental, directed effort at fundamental human behavioral change. Just this picture, if you look at it, Times Square in New York, it's very unhuman not to be out and about and social. Social distancing in of itself is a contradiction in terminus that doesn't fit humans at all. Yet we've seen after the first wave, just got out, we see across the globe, starting in China and East Asia, countries adopting similar rules that would only work to mitigate the pandemic if there was fundamental behavioral change. We even see it in, for instance, this picture of a protest that seems to be in Israel, where people keep social distancing even in protest. That hasn't happened everywhere. And of course, there's many reasons why a barrel of oil hit negative. But one of the reasons, it's an indication that something very, very abnormal was happening because of the governmental regulations that were adopted. So in a sense, I might be overstating, but I haven't heard arguments that say I'm not. I think this is the biggest attempt at behavioral modification in the history of the world. If we look at the scale of it, global, and also at what it's trying to do is to completely, at least for a certain period of time, alter basic human conduct. So it's an interesting situation, not only from a practical point of view, and obviously most of us doing research, if in the early phase we sought to advise government to help them become better at doing this behavioral modification so that we could get through the pandemic. But now that we're sort of a year in, at least in China, I think the theoretical questions are becoming more important. So one of the things I see when I look at compliance research is how siloed it is. I see most of the compliance research has a very strong single disciplinary perspective and even a single or dual variable perspective or a singular approach. And there's very limited research that actually tries to see it from multiple perspectives. So we saw an opportunity here by developing a study that looks at COVID-19 compliance with mitigation measures to actually try and combine multiple theoretical perspectives. And I'll get back to that later. So what did we do? So we did a survey, which obviously has advantages and disadvantages. I'll get back to that later. We all know the disadvantages, social desirability. We're looking at potentially immoral or illegal behavior. There's bias in the reporting. we tried to understand through self-reports what made people comply originally with two kinds of rules when we did the surveys in April, with stay-at-home orders or advisory and with social distancing orders or advisory. And we sought to understand what processes explain it. So we focused on social distancing, but in earlier studies that you can find all the studies, by the way, in corona-compliance.org. We also focused on stay-at-home orders. So we've done multiple studies. The US, we've done spring, April, and we did 3 waves in the summer. Netherlands, we did spring and 6 waves in the summer. And the Netherlands, we've continued from October onwards. And UK, Israel, and China, we did singular studies just in UK and Israel in April and China in July. And China was just Beijing. So when we operationalize social distancing, and today I will focus on the findings from the summer studies that we did in the US and the Netherlands. And by the way, these are not longitudinal studies. They were with different samples each time. So we don't have a full longitudinal view from the same respondents because our respondents changed over time. We corrected that since October. We now have a longitudinal panel set data that we're collecting in the Netherlands. So we focus on people keeping a distance from others outside of their household when they meet with friends and family, when they meet with neighbors, at work, when they go shopping, or when they do exercise outside. So we developed a multidimensional variable to get to the dependent variable, which is compliance with social distancing measures. And it has very good internal reliability. If you want to look at the stats, you can download the papers on our website. We then sought to understand what explains compliance. And here we took a very broad approach. And we did so on purpose in March when the first week of lockdown, when I sat down to design the survey, I thought, okay, what are the different types of explanations we have? And there's different ways to group them. Here's one way we group them. We also have other ways we do in other papers. So generally we can say there's theories about why humans obey or break rules based on their motivation. So it understands human behavior as motivational. It also means that there's interactions that try and steer the motivation. There's, of course, extrinsic costs and benefits. Most known is punishment, deterrence, perceived deterrence, certainty, and severity of punishment. But there's also other costs, the costs of compliance, as well as other costs of violation. There's also all kinds of intrinsic motivations. There's a large different bodies of literature that we group underneath this. There's a whole body of literature in psychology about attitudes. There's a large literature in psychology and social science about social norms. And here, of course, we also find the literatures on legitimacy, which do relate to trust to a certain extent. So it's procedural justice literature like Tom Tyler's work, perceived duties to obey the law, which also follows from that. Then we have on the other side, we have situational theories. And here is a different idea. You obey or break rules because it is hard or easy to obey them, or because it's hard or easy to follow them. And there's different kinds of theories here. Ones are really cognitive theories on, do people actually know the rules? Where we know from research they don't most of the time, or don't understand them fully. Practical capacities, are they able to do what the rules want? And on the opportunity side, do they have the opportunity to violate rules? But there's also other kinds of things that are more psychological. So what state are people in? Do they have sufficient self-control? People with lower self-control are less able to control themselves when confronted with an opportunity for violation. Or do people are they in a state of negative emotions, which we know through psychological and chronological research can create strain that they cope with through rule violation. So that's a very brief outline of the broader thinking behind the project. Then in the survey, we brought this from these main mechanisms into what we can call sub-mechanisms that I just outlined. And these are then these survey types of measures. And for each, we have specific questions. I can go into that if you have questions later. So what were the predictors when we link them back to COVID? So there's the practical capacity to obey the rules? Can you actually work from your house? Is it possible at work, for instance, to keep 1.5 meters distance, etc., etc.? If you go shopping, is it possible to keep that distance? How clear are the measures, and to what extent do you have self-control? This picture, by the way, was taken in London when pubs opened. You have lower self-control, for instance, when you drink, and also people, for instance, when their brains aren't fully developed, which isn't until 21 or 22, also have lower self-control. So that may have been one of the explanations you see in pictures like this, but there can be many others. There's also personal differences in self-control. Are you still able to meet closely with other people? Do you have opportunities to violate the measures? If, for instance, you have no friends, if, for instance, you cannot go to work, if, for instance, you cannot get close to other people, even if you want to, then you wouldn't be able to follow the rules. So it's a bit like speed bumps that we use against speeding. If you make them high enough, it's hard to speed. Costs and benefits, costs of compliance. So what are the effects on your income or on job opportunities and others from following the social distancing measures? Benefits, we operationalize by looking at fear of the disease. So how afraid are you of disease for yourself, for friends and family, and for society in general? Deterrence, classic. How certain do you think the chances are that you are going to be caught and punished if violating? And if caught and punished, how large do you think the impact will be on your life, which we measured in a relative way? We also looked at attitudes. Do you support the measures, and how do you evaluate the authorities? So I think trust in government, if you're interested in that, sort of sits under that authority evaluation to a certain extent, although our survey wasn't focused on trust as the work that Koen just described. Then we looked at negative emotions, which actually fall on the capacity. They shouldn't be on this slide, which is, do you, because of the measures, feel more negative emotions? As I said earlier, you may cope with them through rule violations. And then we also looked at behavior of others. Here we draw on social psychology. If more others are still not keeping a distance, it's more likely that you also won't do so. Then for legitimacy, we looked at procedural justice. How do you perceive the enforcement of the rules in terms of fairness, according to measures that Tom Tyler and others developed. And finally, and this is related to it, we also looked at people's perceived obligation to obey the law. We used 3 types of measures. One was directly drawn from the original Tyler's work, which has been developed also by others. This is called normative obligation to obey the law, where we draw on Chris Posh and John Jackson's work from LSE. The other is a measure I developed in my own group together with Adam Fine from the University of Arizona, from Arizona State University, and it's the rule orientation measure, which is similar to Tyler's, but we think it's a better measure. So we used both. So they're both measures of should you always obey the rules, even if most people don't follow them, even if they're not enforced, even if they go against your morals, etc. And we also had another measure which comes from Posh and Jackson and others, which is a so-called non-normative duty to obey the law, non-normative obligation to obey the law, which is sort of, do you obey rules because you fear what happens if you don't do so? I'm not the big fan of the measure. I mention it for being complete because it's very similar to deterrence. Okay, long story about the operationalization. I'm sorry, in this PowerPoint, I don't show you the exact stats. If you're interested, look in the papers, but I wasn't sure if everybody reads regression tables very well. So I just do the dumbed down version here. What you see here is the predictors for the waves that we did in the Netherlands. And what you can see is in green are things that are significantly positively predicting a compliance. So the more practical capacity to comply, the more there will be compliance. I'm only reading those that in most waves have a significant effect. The more you think you agree with the measures, the more you think you should follow them. The more you feel you have an obligation to obey the law, the more you follow them. the more you perceive a health threat, the more you will follow them, and the more you see others complying. So those are the positive significant predictors. Then on the negative side, the only two that really are positive in more than half of the waves are impulse control. The more impulsive you are, the less you comply. Nothing surprising there. And the same for opportunity. The more opportunity you have to still meet with others and be close to them, the less you will comply. So we have something similar for the 3 waves we did in the US, and I also added a calculation for all of them. We have the same for the Netherlands in our paper, it's just not on the slides. And here we see very similar things: practical capacity to obey, impulsivity. We don't see opportunity as clearly. We see it across all the waves, but not in the individual waves. It's probably because once you have more data, things become significantly easier. We see support for the measures. If you agree with the measures, there's more compliance, and we see health threat. Also, we see social norms over all the waves. We don't really see much effect of obligation to obey the law here. So, conclusions from the surveys. So one of the things that I think is interesting, because very few studies have looked at this, which is surprising. I've also seen that with the Dutch government. There's very limited advice on whether enforcement actually does something, even though it's the core policy tool that governments look at. There is no evidence that enforcement contributes either positively or negatively in the Netherlands or the US. That doesn't mean that we shouldn't be enforcing. It just means that we can't, in our measurements, see that it has an effect, positive or negative. We see intrinsic motivations matter. We also see that situational variables are very important: practical capacity, opportunity, perceived threat, and capacity. And we see some differences. We also saw that when we looked at the waves over the summer, we saw during the summer that most of these positively correlating variables that shaped compliance, as well as the negative ones, the positive ones went down and the negative ones went up. And of course, we've all seen what happened after the summer. There's been an immense increase in non-compliance and also in the spread of the pandemic. And the big problem is, if you look at the analogy of the hammer and the dance that many of you may be aware of, we're quite good at the hammer. So the lockdown, then you decrease situations, you don't give much choice to people, and then behavior changes a lot. Once you lift the lockdown and you lift the hammer, you have to go back to motivational influences, and it's much harder to sustain these over the long run. We also looked at trust in science. This may be of interest to you. We also looked at political orientation. We didn't find these in the full models were good predictors once we entered them fully. In the controls, trust in science did predict, and political orientation in of itself did predict, but once you put trust in science in a model, there's no effect for political orientation. So very briefly, I know I'm running late. I just wanted to say we also did a systematic review of social distancing studies that have come out for the first wave. And in the end, we narrowed down 91 studies into 45 studies to be included. And if I just go to the findings, we see actually quite similar things: fear of the virus, psychosocial factors, social norms, and several institutional factors, as we call them in that paper. We do see, again, deterrence. It's not significant. It's not surprising, because the only studies that measure deterrence are our own. Political orientation, it's not significant in most studies, and also support for authorities. Whether you support the authorities is not a major one. If I go to my concluding thoughts, so one of the things we see is, if we're looking at what happens here, it's very similar rules. We do see similar findings, but the nitty-gritty, if you really zoom into the samples, you do see that they're context-specific. They're context-specific in time. Things change over time as we move from one wave to the next, or in between waves, and also they're very country-specific. This also makes it very hard to draw out strong comparative conclusions, because you need to know so much about these countries, and also what happens in pockets within the countries. One of the things we see is that a lot of the research on compliance with COVID has really been driven by the theoretical perspective of the scholars. We see psychologists just with an interest in attitudes, political scientists interest in trust, as in this group, and in political orientation. There are very few studies that actually try and holistically understand what would be possible influence on compliance from all theories and measure those. Very, very little has been done on that. There is a fundamental measurement challenge. Ours with surveys obviously has the problem that we don't know for sure whether what the amount of bias is in the self-reporting. For this reason, we've started to collaborate, and you can find more on compliance.org. Yeah, I'm almost done. We started to collaborate with researchers from the Free University in Amsterdam who also study camera footage, and also communication scientists who study social media posts. It's like the blind man and the elephant. We all have our own limits in the research. For instance, if you have camera footage, you only see behavior outside on the street, which is not where the big risk is. And also it doesn't mean that you actually have the actual behavior that's taking place at work or at home. We also believe that we can't really rely on single studies. You need the systemic reviews to really say something about this. You need the broader research design, and we need to overcome these theoretical and academic silos. I think it's great that we do research to try and isolate the effects of deterrence on compliance, but it doesn't really make sense unless we also put other variables in models and we actually can get broader to that. Final word on behavioral bias. I lead a large ERC project on behavioral assumptions in the legal system. It's called Homo Juridicus, and it's all about that we develop these regulatory systems and legal systems to change human behavior, but largely they're developed and operated by lawyers who don't have any training in behavioral science. And everybody's human, everybody has assumptions about what changes behavior, but these assumptions may not necessarily align very well with what we know in science. So we're doing a range of experiments and studies to actually see if we present the science to different people, both people that are experts in roles of experts with power, as well as general populations, to see under which conditions they will accept the scientific insights about behavior or not, and what biases are at play here. I'm happy to talk about that during the Q&A. Sorry for going a bit over time, and I look forward to the Q&A.
So thank you very much, Benjamin, for this very fascinating presentation and for your call for more holistic approach in this area. We have, of course, time for questions, so people can either put their questions in the chat and then I will call them, I will repeat them, or you can, if you prefer, just put the microphone on and your camera on. But try to be brief and concise so we have time for a few questions and not just one big expose by, by one person commenting. So who would like to take the floor?
Yeah, I'll move on if possible. So thank you very much, Benjamin. Thank you very much all for organizing this. It's fascinating as usual. And I'm asking myself, Benjamin, what can how should I change my own way of thinking about regulation and the relations between regulation and trust and regulation and capitalism following your compliance approach? So I can think about few ways, but I'm curious to see what would you suggest, you know, to the field more generally, out of this study and more generally from your compliance perspective?
Sure. So I think what you're asking is a fundamental perspective question. So the perspective I'm presenting here, it's not the only perspective I have, as you know, David. It is more of a micro perspective. It's also a very empirical perspective. So it is a perspective where the basis is that we cannot assume beforehand, if we set up a rule in a certain way, that it will function in a certain way in creating a certain behavioral response. It means that we always have to look at, okay, what actually happens? So for instance, a very basic thing that most people forget about is that most rules we make, nobody ever learns about them. So I just finished editing the handbook, Cambridge Handbook on Compliance. I'm happy to see Sigvard Lindenberg also here, who's also in the handbook, the great chapter on social norms and on contagion and norm framing theory. I wrote a chapter in that book on knowledge of rules, and I was shocked when I found out, just looking at many reviews, that both non-experts and experts don't know legal rules. They don't know them. Yet we keep on creating more and more and more detailed rules, assuming that if we make a rule, it will do something. There's this whole idea of sort of, well, if we make text, it will do something. So I would say the first thing that a compliance perspective, as I follow it, brings is looking back up at the rules and saying, okay, what actually do they mean at the front line where they're going to operate? Once you look at that, it's of course about way more than just whether people know the rules, but I mentioned knowledge of the rules first because it's such a fundamental disconnect. When people don't know the rules, everything else you're assuming about that is out of the door. If we then look at trust, that also becomes a highly empirical question. So it becomes a highly empirical question to seek to understand at which levels trust mediates or interacts, and there's different ways in which it obviously does with behavioral responses. So behavioral responses themselves can be expressions of distrust. If we look at, for instance, the protests we've just seen in the Netherlands with the curfew we had at night, one way to look at them is a massive form, a very violent form of distrust. Of course, trust in of itself is also a variable that shapes the behavioral response. But I think looking at that empirically through what do we see in the agency and the structure, and not just through the structure, to put it sociologically, is very important. And I think sometimes some scholars are too much in structure and some are too much in agency. I could talk much more about this, but I want to leave the floor also for others to ask questions.
Yeah, thank you for that. And thank you for the explanation. I noticed that also Maciej Pichlak had a question.
Thank you very much.
Sorry if I pronounce your name not in the
Not at all. Thank you very much for this presentation. I think your last comment might make my question a bit pointless, but anyway, it's a short question, so let me ask it. Have you noticed any significant impact of the quality of laws on the compliance? I mean, mainly procedural fairness and clarity of rules. These are two factors that you have mentioned in the presentation.
Yes. So I'm happy you asked it. So in my PhD, which was about the regulation of land and pollution in China, I developed a whole chapter on quality of legislation from the perspective of implementation. So this goes back to David's question. Already at the time, I saw that many people in Beijing said, we have good laws, but they don't work locally. And I started to ask, what are good laws if they don't work well locally? So I think the first question I would put back to you is, what is quality of law? How would we even predefine that? And it seems from your question, yes, we can define the quality of law maybe through the process it was made in. So that would be procedural justice. In the earliest survey we did in April, we still had questions about the process of lawmaking. The problem is with a survey, most people don't really have a perception of how the laws are made. So even if we get answers to them, I'm not sure I believe that an average citizen knows much about their own voice or their own. I mean, they only give answers to something we have prodded them to think about. So I find that a difficult thing to get to in a large system like the Netherlands or the US. Clarity, of course, is a quality measure. The problem is when I look at it from an implementability point of view, there's a trade-off. The clearer and more precise rules are, which a lawyer will think is very good measure of quality, the harder they will be to adapt to different circumstances. So you need rules that are both flexible and clear, which is hard to combine. So for me, I mean, clarity is not it's an ideal typical part of quality, but not a full quality. For me, the quality is a trade-off if we look at the substance. So I think it's a great question that our survey doesn't answer because we didn't operationalize it in that way. We just operationalized it for the measures that I discussed. It would be good to look at this. The difficulty is I wouldn't know how to operationalize quality of legislation that incorporates my full, more complex understanding of quality of legislation. Sorry for that.
So thank you for that answer. Indeed, there was also a comment in the chat about the quantity of rules and the possibility to comply. So we have both the quantity and the quality side. I think for lack of time, we will need to move on to the next panel. But I also see, for instance, an invitation from Patricia Popelier to have a conversation with you on accessibility of rules. And actually, she's also the first speaker of the next session. So that makes a nice link to the next panel. So if you allow me, unless you want to make one final statement, I would like to move on.
I mean, what Dominica says in the end, I also argue in the chapter. You don't necessarily need to know the rules to follow them. And there can be rules that already codify existing behavior. You could follow others. There can be technological systems that force you to follow. Yet the reason I mentioned knowledge is that in discussions, especially discussions amongst lawyers, but also among regulatory scholars, we often forget the fact that most people don't know the rules. And I think it is a major empirical fact that should feature more in our research, because it's sort of, it undermines. So it means, yes, there may be other ways, but you have to be aware that that is the mechanism that's at play, not necessarily a rational choice. So I fully agree with what Dominica said.
Great. So thank you for that addition. I think our next, and I'm now sharing again. So I hope you can see the presentation again. So I think the keynote from Benjamin van Hooy will be very nicely and aligned to the next panel, which is on trust, regulation, and compliance. And as I already indicated, our first speaker is Patricia Popelier. So she's also a promoter of the GOVTRUST Center, and she's a professor at the research group Government and Law. And so she specialized in federalism, multi-level governance, constitutional law, also legitimacy and legal certainty, together also with the notion of flexibility that Benjamin also just referred to. So this whole issue of balancing and the trade-off is also really very core to her research. So I will stop sharing and allow Patricia to start sharing her screen, because she actually has a very difficult job. She will be presenting 4 papers in her presentation. So Patricia, I will immediately give you the floor now. Please go ahead.
Yes, thank you very much. Well, let me just immediately jump into it. And indeed, as Koen already told us, GOVTRUST only just started running when the coronavirus spread around the world and hit Belgium quite hard. And we took the opportunity, because of course this impacted on the center's research agenda. We did other things as well, but today we will mainly focus on our publications or research related to COVID-19. And in this panel, it is about regulation and trust. I will present 4 panels related to this topic. And well, these are 4 very different papers, although they all have to do with COVID-19 management through regulations. One thing that they have in common, with the exception of paper 3, is that they are based on the new data that we gathered in the surveys. And Koen already told us about these 2 surveys, the Big Corona survey. 2 papers were based on that, and one paper was specifically a survey was designed specifically for that. So the big advantage of the Big Corona survey was that it had a very high response, more than 200,000 in the first wave and still 25,000 in the third wave. The drawback is that we were part of a much larger survey, which gave us room for only a limited number of questions. Paper 2 is based on our own survey. And so we had more control over the questions, but there were fewer respondents. We had about 1,000 responses. Now, another point that the list of papers reveals is the multi and disciplinary nature of our center. Paper 1 and actually also paper 4 are genuine social science papers, although in paper 4 also Pierre van Damme, who is a renowned virologist, participated. Paper 3 is legal analysis, and then paper 2 is truly interdisciplinary in both method and outcome. Here, social scientists, legal scholars, and an economic behavioralist join forces, and we construct an experimental vignette survey on the basis of a legal problem setting, and with the results we contributed to social science literature as well as legal scholarship. And another disciplinary paper is on its way based on a recently held experimental vignette survey on the use of the Corona app. And here legal scholars collaborate with public administration scientists and a communication scientist. So we hope to tell you more about that next year. In the heat of the Corona crisis, different projects were run separately, but now is a good moment to take a step back and to look at our results and how they can be linked. And the first paper already came with some interesting results. It starts from the extensive literature that shows a positive relationship between trust and rule compliance. And this study tests the relationships between trust and other drivers for rule compliance: fear, rule legitimacy, pro-socialness, social contagion. So the willingness to put the needs of others above one's own interest, as well as what Benjamin already pointed at. If people observe that other people comply, they will more easily do so as well. And the paper looks at this relationship over time at different phases of the crisis cycle. And so it shows that the interactions of the drivers of rule compliance vary at different phases. Here you see, for example, for trust and pro-socialness, goes from non-significant over time to positive or negative effects. It also shows that social contagion has the highest explanatory power for rule compliance. Connected to this paper is paper 4, where the willingness to have a vaccination is examined. But first I want to point out 2 aspects that have a link with papers 2 and 3. And one is the examination of legitimacy as a driver. Now, the hypothesis in paper 1 was that rule legitimacy has a positive effect on rule compliance during all the phases of the crisis. And this was confirmed, although in itself not always in a significant way. In this paper, rule legitimacy was interpreted as a situation in which rules are seen as appropriate, effective, and deemed to be right, meaning that they were assessed as able to fight the virus spread and not restricting rights more than needed. This is an interpretation that is very focused on so-called output legitimacy, whereas input legitimacy and throughput legitimacy, that is, who actually decides these measures and how, was very much at stake too in this crisis. This is where paper 2 and 3 come in, and I will discuss this further on. Paper 2 has still another link with this first paper. It was observed in paper 1 that impact of trust as such is not very significant, but more than that, when all the drivers are accounted for, the impact of trust is negative. Even people with low trust may nevertheless comply with the rules. The authors suggest that this outcome is the result of the design of the study. Rule compliance was measured with respect to preventative epidemiological rules, and trust in government was about the government's overall crisis performance, including the mitigation of negative economic and social consequences. So people may have low trust, for example, because their enterprise is not doing well or they have become unemployed, but still they believe it is relevant to comply with the preventative rules. It is this weighing of effects, safety against social and economic needs, that is a subject of our paper 2. Now, the starting point in this paper was the observation that the Belgian Council of State gave the government complete freedom to handle the crisis. It avoided most cases by finding the request inadmissible. And where it did decide on the merits, it extensively argued why the government's act was justified, thereby giving little attention to the petitioner's needs. The paper examines whether there is more room for judicial oversight of the health crisis measures. Now, judicial restraint is based on 2 arguments. The judges are unelected and therefore they have no legitimacy to second guess the government. And secondly, they do not have the expertise to counter expert-based decisions. Now, empirical studies have confirmed positive relationships between aggregate public opinion and courts' decisions. Usually, this corresponds with the courts bonding with the government, as what we saw here with the Council of State. But in turbulent times, courts also aligns with the public. And in this case, there was a political crisis and a minority government that acted on the basis of just a ministerial decree without backing from Parliament. We therefore try to examine what the public expects from the government to delineate from there the space for judicial supervision. Now, based on the well-known rally around the flag effect, we saw little room for the courts in the first phase. The public backs the government and an unelected court has not much legitimacy to go against that. But what in a second phase, when people start to suffer from the drastic measures and there is some room for more relaxed measures? So we constructed 3 fictional scenarios. We already saw that trust was declining in this phase, and we constructed scenarios which were fictional at the time. The duty to wear mouth masks when we launched the survey, this was not yet a duty. It came in the middle of our survey, but it was not yet at that moment. Then measures surrounding the right to demonstrate or to go to concerts. One group received information about the expert advice only, and the measure slightly deviated from that advice, sometimes more lenient, in one case more strictly. Another group only received info about the social needs behind these measures. And a third group received both types of info, inviting the respondents to balance both. Now, our study confirmed that in a second phase, the public still expects the government to take preventative measures, but it does no longer assess government measures from a safety perspective only. There is more support for measures that were framed as accommodating social or sexual needs, even if they were found less effective, but on the condition that the measures do not deviate too much from expert advice. The study reveals that the public's perception can be steered on the basis of the information that is provided. This is important in light of the fact that expert advice was disclosed from the public's eye in Belgium for a long time, and there is still not much transparency. If government wants public support, they need to communicate how they've taken into account social needs, while at the same time remaining more or less within the boundaries of expert advice. And we differ from that the public wants expert-informed government action. This is a framework that determines the court's space for assessing crisis measures in later phases of the crisis. In a normative theory, that is what legal scholars do, this means that the Belgian Council would have had the legitimacy to act as a guardian of fundamental rights by requiring transparency as to how the government has balanced interest and whether the affected group or sectors have been consulted. Comparing paper 1 and 2, the focus on legitimacy has now shifted from the output to throughput legitimacy. In paper 3, I examined the preventative measures from the viewpoint of input, throughput, and output legitimacy. And the paper assumes that the optimal balance of input, throughput, and output legitimacy varies. In times of crisis, for example, the executive comes to the fore even more than in normal times, but a decrease of input legitimacy can be compensated by an increase in throughput and output legitimacy. Now, surprisingly, in Belgium, the role of the Belgian parliament was better secured in times of a minority government than what we could have expected if the crisis was dealt with by a majority government, as is the case at this moment. Nevertheless, input legitimacy decreased substantially because the entire preventative measures were based on a ministerial decree without a solid basis in an act of parliament, and still are, even now that we have a majority government. This was compensated by high reliance on expert advice, that's throughput legitimacy, and in a first phase, a high level of output legitimacy. The measures were generally well adhered to, and a stagnation in the growth of the crisis was reached little more than 3 weeks after the first fatality. But later on, there was a decline in trust. And in paper 1, the negative relationship between trust and compliance was explained as a disappointment in the government's ability to mitigate social and economic effects, and thus a decrease of output legitimacy. Now, a decrease of output legitimacy requires an increase in throughput legitimacy, recommended in paper 2, and an increase in input legitimacy, which is a topic of paper 3. In another paper for a Flemish journal, the lack of input legitimacy was further elaborated on, arguing that the crisis management by ministerial decree is simply unconstitutional. We then took the initiative with 25 constitutionalists to launch a public call for an act of parliament as a basis for the corona policy. This was met with much support from people in enforcement and adjudicative positions. Governors and judges contacted us, but also with much criticism from colleagues who were indignant because we were making things difficult for the government, and especially because we had publicly contradicted a venerable institution such as the Council of State. Now, the government is now elaborating a corona law after all, but with little urgency, and the Minister of Justice announced, oh, it's just to be used for subsequent crises only. Meanwhile, we have arrived at a phase in which vaccines have been developed. It is now important to know what can trigger people into taking these vaccines. This is where paper 4 comes in. The study explains the vaccination intention by linking it to trust in government and trust in experts. It shows that individuals that perceive a high risk in face of the coronavirus are more willing to get vaccinated. Here, especially, the perception of the severity of the risk is important, more than risk proximity or vulnerability. Also, pro-social individuals are more likely to get vaccinated than others. Like paper 2, this reveals a balance of interest that citizens perform towards crisis regulation. Further, both trust in government and trust in experts increase the likelihood of getting vaccinated, but the effect of trust in government is much smaller than the effect of trust in experts. So it is in the interest of the government to secure the credibility of it relies on. Even if some other factors are probably important as well, the confidence in the vaccine itself or religious and moral convictions, this is nevertheless an important message for the government that aligns with the outcome of paper 2 and the argument in paper 3. So this is in a nutshell the overview of our papers on trust, COVID-19 regulation and compliance. All the relevant authors are here to give more insight into the details of the study and the methods that we used. And I'm looking very much forward to the discussion. Thank you.
Thank you, Patricia, for that excellent presentation of 4 papers and bringing them all together, also showing a little bit the desired holistic approach that Benjamin was referring to. Unfortunately, we need to ask you to hold, or you do not have to hold your thoughts. You can put them in the chat, but we will move on immediately to the next presentation, which is a presentation by Thomas Frimmel and Sarah Geber from Zurich, from the University of Zurich. And so they are specialized in media use, media effects, especially within the context of health communication, also using different methods, but especially also focusing on social network analysis. And what is interesting also there is, of course, they're emphasizing the importance of information, the importance of communication, and then also the link with trust. So that's also a very nice complementarity then with the presentation by Patricia Popelier. So I'm not sure who will start, whether you will both do it together, but at least you definitely have the floor. Please go ahead.
Thank you very much for the introduction. You can hear me? Everything's well?
Yes, we can hear you very well. Thank you.
Perfect, perfect. Well, we are very happy to share our theoretical and empirical work regarding the role of social norms and trust in the context of the COVID-19 pandemic. As it was mentioned, our research, the research of Sarah Geber and myself, focus on social dynamics of health behavior and the influence of various forms of communication on these dynamics. With respect to COVID-19, various prevention and coping strategies were discussed in the past year, but they all have in common that they only work if the majority of a population follows them. So this holds true for wearing a face mask, social distancing, using a contact tracing app, or vaccination. For all these measures, it is needed that compliance of at least 60% or more of the population adheres to it. And of course, it would be great to achieve this compliance with as little governmental enforcement as possible, because every enforcement triggers reactance, and this is not always much fun. So this brings us to the concept of social norms. Social norms socially regulate compliance with health preventive measures. We know from research on various topics that perceived social norms have an influence on people's behavior and thereby influence effective norm. In the best case, this leads to a positive spiral in which perceived norms increase effective norms, which in turn increase the perceived norms. And as we have seen in the presentation just before, this form of a social contagion is likely to be among the most important factors for compliance. However, these social dynamics may be too slow to respond to a public health crisis. And the only shortcut is to have recommendation by a trusted actor. In the case of COVID-19, as a national and even global pandemic, these are the governments and health authorities. In addition to a trust, trust in the governments, trust in the news media is important, since they do not only transmit these governmental recommendations and expert voices, but also provide insights into the compliance with these measures beyond the limited personal everyday observation. So if I walk around the street, I can see how many people are wearing face masks, but the media will report me whether this is the majority in a country or whether there are violations to this. Well, Sarah and I will show you our insights from 2 empirical studies in which we investigated the role of social norms regarding health behavior and discuss the impact of trust on it. The first study on social distancing and is on social distancing, and the second one on a Swiss contact tracing app. Both publications are still under review. I get the impression that in our field, review cycles tend to be longer than compared to your field where you already have meta-analysis. Well, our study on social distancing is based on a representative survey among 1,000 Swiss citizens. And we have conducted this survey last March during the very first week of the lockdown in Switzerland. Among others, we have asked the people to rate their trust in the government and various news sources on a 5-point scale. And as you can see on the left side, trust in the crucial governmental actors as the Federal Office of Public Health, the Federal Council, and the Swiss healthcare system was very high. But also on the news side, foremost the public radio and TV stations scored quite well on this 5-point scale. So we have actually quite high trust in these institutions in Switzerland. Furthermore, we have asked people to indicate how important 3 distinct forms of communication are for them to be informed about the COVID-19 pandemic. These are news media, social media, and personal communication. Based on health communication and health behavior theories, we assumed that using classic news media will increase the perceived efficacy of whether social distancing helps to reduce the risk. This is called response efficacy. And second, whether they consider social distancing as something that they are able to do. This is called self-efficacy. Both holds true as it is indicated by the 2 arrows. The same holds true for perceived norms that can be separated into what I perceive what others do. This is descriptive norm, and how important it is to comply with these norms. This is called injunctive norm. Finally, we assumed also effects on the perceived severity This is how negative it would be to be infected by the virus, and the susceptibility, that is the likelihood of getting infected. Again, we found significant positive effects. Personal communication only had an influence on perceived norms, and the use of social media had a negative effect on perceived social norms. So we see different effects from the three forms of communication on perceived norms. And the next question then is how these factors did influence social behavior. As you can see, with the exception of perceived severity, all factors had a positive effect on social distancing, and these factors explain a quite impressive share of variance. As we have just seen before, this model is supported by findings from other studies, such as the data from the Netherlands, where exactly these factors were the ones that proved to be the most relevant across the time. But the ultimate question for this symposium, I think, is whether and how trust does influence all of this. Our analysis shows that trust in media has a positive effect on all communication behavior. This means the more people trust in news media, the more they use news media. This makes sense, but also the two other forms of communication regarding COVID-19. Trust in the government has a more complicated but plausible effect. The less people trust the government, the more they use social media. And as we have seen before, this reduces indirectly the perceived social norms, which are crucial for compliance with social distancing recommendations. So this can be a critical point here. In addition, positive effects of trust in the government were found for efficacy and social norms. In sum, this first study shows the importance of trust in news media and the government for the implementation of health prevention measures such as social distancing, and the relevance to consider these factors of efficacy, norms, and threat as explaining variables in the model. Now, Sarah will present you the findings from the second study.
Yes, thank you, Thomas. As Thomas already said, the second study is on the adoption of the tracing app in Switzerland. So the Swiss COVID app was introduced by the end of June last year. And we conducted a two-wave online survey to test our theoretical assumptions in a causal sense, with the first wave in July and the second one in September. And I will guide you quickly through this complex figure. So the most important thing is that we can see that we can explain more than 40% of the intention to adopt the Swiss COVID app, and about 12% of the actual app adoption. With regard to predictors, we see that the perceived usefulness of the app, as well as the perceived ease of use, are important predictors that support app adoption. Furthermore, we can see with regard to COVID-19 that the more severe I perceive a COVID-19 infection, the more likely I intend to adopt the app. As expected, perceived threat of data misuse reduces app adoption. Again, we were particularly interested in the role of social norms, and what you can see here in this figure is that the role of social norms was twofold in this case. So the perception that many others in the population use the app and that it is highly approved in the social environment hides the perceived usefulness of the app. And this is kind of a heuristic, so that the perception others do it, then it must be a good thing to do. Beside this indirect effect, however, the social norms have also a direct effect on the intention to adopt the app. So again, for this model, we integrated trust and post-hoc for this talk. And this time we differentiated between governmental trust and the trust in the developers of the app. And what we can see is when we integrate both trust dimensions at the same time in our model, then only the trust in the app developers affects our app and disease-related perceptions. It is notable that trust reduces perceptions about data misuse. So what we see here generally is the pattern that trust heightens perceptions about that support app adoption and reduces perceptions that are barriers to app adoption. So this demonstrates the potential of trust in our results. This brings me to our discussion. So given the findings of both studies, we can conclude that social norms are important drivers of individual health preventive behavior. And second, that social norms are shaped through communication. That is what we have found in the first study on social distancing. And based on these findings, we have set up our project COVID norms, in which we monitor prevention behaviors, attitudes, perceived norms in this risk population, and the media reporting about the measures. And when I say we monitor it, I mean that we conduct survey and content analysis on a weekly basis. So we can monitor trends in behavior and norms and the reporting about the measures. So the project's aim is to better understand norms of prevention behavior, how they evolve and develop over time. With regards to trust, we found that there's a need to differentiate and integrate various forms of trust. So we found that governmental trust is important predictor, media trust, trust in science. So as an outlook, also trust in others in the society might be important, especially with regard to social norms. All in all, we can conclude that we have found that trust is an important prerequisite for compliance with health and protection measures. And I think that is a good point to end here. I want to thank you for your attention, and we are happy to discuss our findings with you.
So thank you for the presentation, Thomas and Sarah. And before we go to the questions from the audience, we also have a discussant. Our discussant today is Per Lagrette, a very well-known emeritus professor from the University of Bergen in Norway, specialized in public administration, organization, public reforms. He has written an enormous amount of books and publications on this. And so we're very honored to have him as a discussant. He's also one of the scientific advisors for GOVTRUST. And so Professor Lagrette, I will now stop sharing my screen and give you an opportunity to start sharing your screen, because as I understood, you have put some of your comments or discussion points also on slides. Is that correct?
Yes, can you see it?
We now see you, but not yet the presentation.
Oh, there you are. Then I don't know what to do. Maybe I just go on without any kind of present.
It's as you prefer. So
Let me
do it is
give
to
it
save your presentation another time and then try to share it. Sometimes if you have tried to open other documents, Zoom.
Okay, time is running. I just think I go on without any kind of
Perfect.
PowerPoint.
We can share your slides also later. No worries.
Yeah. Okay. Thank you for inviting me to this webinar. It's really impressive to see how much you have managed to do on Corona in this project already. And regulation, trust, and compliance is, of course, to the core of crisis management. But I think it's important to first start by saying something about what kind of crisis this really is, because crises are very different, and this is a very special kind of crisis. It's a creeping mega crisis. It's a lot of complexity, transboundary, crossing policy areas and administrative levels. Second, it's a lot of uncertainty. This is not evidence-based policy making, because there is a lot of uncertainty regarding means-end relation. What works? How sure are we that the different means and measures and regulations actually works? And third, it's a lot of ambiguity. Ambiguity regarding values and goals also, especially regarding values. We have life and health issues. Second, we have individual rights and civil rights. And third, we have economy, unemployment and bankruptcy. So the government has a very tough work to do to try to balance these different values. And there is a lot of urgency. Important decisions have to be taken under a strong time pressure. And this is really then a stress test for the government crisis management. It tests the limits of what public bureaucracies are actually organized to handle. So it's no wonder that, that this is very complicated. Okay, and how does this work to trying to handle this kind of crisis? And I have some comments and remarks, and they are not directly related to all these rather complicated presentations that we have on empirical studies. But I think my main point is that it's important to combine the issues of governance capacity on the one hand and governance legitimacy on the other hand. And I think that's also to the core of this project. Not only capacity matter, but legitimacy also matter to a great extent for crisis management. And we really need to understand how the relations are between capacity issues like regulatory capacity on the one hand and trust and legitimacy issues on the other hand. So of course, when it comes to legitimacy, trust is important. And there are different kind of trust, as we have seen now. It's of course trust in government, but also trust in expert, trust in media, and not least mutual trust relations among the citizens themselves. And we see in some countries mass polarization, uncooperative societies, and more or less uncooperative political elites as well. And this is a very important to understand, and the relations between trust and capacity. But I would also say that crisis communication is very important, and that's an issue that has not been addressed so much so far in this presentation. We need when the government is able to have a convincing and reliable and credible and effective crisis communication, and you have credible executives, then the possibilities also for effective compliance with the rules and regulations is much better. And this is something that we have seen in the case of Norway, for example, a very effective crisis communication and meaning making from the government side. And when it comes to compliance, I think it's also important to distinguish between different types of compliances. On the one hand, we have the hard compliances, mandatory regulations, laws, and that kind of things. And on the other hand, you have the soft measures like advices and pep talk and recommendations. So I would think that it would be important when you are looking at the issues of compliance and trust and regulation, you need to differentiate between different means and measures, between different kind of regulation, especially between the soft measures and the hard measures. And I also think that time is important, and this is why these data from Belgium is important. You have time series here. Also, different presentations have these kind of time series, because when this crisis evolves, it also changes. So there are very different way of handling the regulatory phase, the deregulatory phase, and now the re-regulatory phase. So we are now, I think, in the re-regulatory phase after we have this kind of softening and opening up period in the summer. So and when times go on, people it's more and more difficult to get people to accept the rules and regulations as look like. So the time period, the time, how long it lasts is very important. I would also like to add that appropriateness is important, not only kind of consequentiality. I have a feeling that some of the presentations are focusing much on this kind of rational cost-benefit way of thinking. But if you look at what's appropriate to do, it's much more about values, norms, and identities, and to fit the recognition identities and rules, and then we are over in institutional theory, and I think that also have some interesting thing to add. I guess I have more or less used my time now, so I had a couple of more but I think I stopped there to open up also for other questions and comments.
Yeah, so I think this is already very rich in terms of comments, and of course the broader comments we may also transfer to the authors later on. I would like to maybe first give a brief moment to the authors to respond to these comments, and then I see that there's also some comments in the chat, but maybe first to the authors. I don't know who wants to go first, Patricia or Thomas and Sarah?
I could just follow up on the point of what is appropriate, and I think this is came quite clearly out of our study that efficacy is very important for people, right? It is important for people to feel or get the impression that the proposed solution has an impact and that they are able to perform it. And so I think when we also compare our findings with the one from the keynote, where we had a long list of potential effects and what we could also include and what other factors could be of relevant, it was, at least for me, quite striking that actually it reduces down to this efficacy, norms, and threat factors that seem to be most important. I also would like to add that we had, because I saw it in the chat, kind of what about this and what about that argument, that it is quite interesting to the topic of COVID that it is not like the typical socio-demographic dimensions that have a strong influence in compliance. So in our analysis, we found that more or less age was the single socio-demographic factor that actually had an impact on attitudes and behavior. And all other factors such as education or income and other variables, they simply did not have a strong impact. So I think it's quite a unique challenge, and this is also something that was now mentioned at the very beginning of the response, that is entirely new. It's a unique situation where we many things that we used to focus on in our analysis, such as socio-demographics, might not be as relevant as we used it to be.
Patricia, do you also want to comment on the discussion points raised by Professor Legret?
Well, I just want to go into one point, and maybe I probably misunderstood. I just reinterpreted as a legal scholar, but where Peter, thank you also for your comments. But where you were pointing to values and institutional theory as a legal scholar, I translate that into the debate on democracy and the rule of law, which was very much at stake here. I think especially in the Netherlands, it was a very important topic whether there should be an act of parliament. And in Belgium, there was just this ministerial decree for constitutionalists. This is a horror. There is no debate, there is no parliamentary backing. It's just one minister signing for everything. And the government just dismissed that as something unimportant. So what are you talking about now? This is a crisis. You know, we don't need all this stuff. This is for times when we have the room to just play a little around. And I was really wondering, does it matter for the people? Does it matter for the trust they have, and etc.? And that is not something that we really investigated.
So thank you for that. Just to take up some of the issues that were raised in the chat and that you may also both want to comment upon. So David Levy-Fauer also mentioned that the politics of this are not really so much mentioned in the presentation. So interests, ideas, and institutions, conflicts. You already referred a little bit to that now in your answer, Patricia. And he also raises the fact that, of course, in terms of incompliance or compliance, there should be a distinction between mass incompliance or individual incompliance. And then apart from that, another more methodological comment on how the questions with respect to trust were being asked. Was this really about generalized trust or more specific also linked to the crisis and the crisis measures? And so in terms of Antwerp, I see Peter already responded a little bit to that, and it will also come back in the panel after the break. So there were, I think there were both types of questions, more generalized trust questions, and also more specific ones on how the government is dealing with the crisis. But maybe Sarah and Thomas also want to be a little bit more specific as to how they phrased the questions in terms of trust.
So perhaps I can start. With regard to trust, we asked for general trust and not related to the present COVID-19 situation. Also, because we wanted to compare it with trust measures before the COVID-19 crisis. So all trust measures were independent of the present COVID-19 situation.
Do you also want to say something about the comments of David Levy-Fauer in terms of politics and in terms of compliance, mass compliance, individual compliance?
Okay, perhaps I can add some idea of our COVID-19 project here, because of our norms project. So I think the idea of mass incompliance is addressed in the idea of collective norms. So we are interested in what predicts individual behavior, but in aggregate, we can see what predicts mass behavior. So the idea is that perceived norms are located at the individual level and are predictors of individual behavior, but that when we take a perspective higher, when we go on the national level, we can see how many people actually comply to a measure, and that we understand, or that is what we define as collective norm.
A short addition to this response, the crucial question is also, is the compliance, is it visible? So for instance, wearing face mask is of course quite visible to everybody, whether I'm wearing a face mask or not. Whether I have, for example, installed a contact tracing app is not visible. It's not visible whether I got vaccinated. So this difference between different kind of visibility, we perceive it to be very important. This is why we try to compare all these different measures.
So thank you for that clarification. Benjamin van Rooij, is it correct that you were raising your hand? Do you still want to?
Yes, but I don't want to take too much time. I had one question, which is, how would both papers, sorry, there's multiple, but both groups account for situational variables, as I called them? Because it seemed when I heard your presentations, they're very much focused on what we call motivational variables, and there's a whole range.
Mm-hmm.
Do you also look at whether, especially when you're looking at distancing, as some of your work does, opportunities and capacities for social distancing, we found across all our studies, especially in capacity, was very much a predictor, a strong predictor. And our squares, which I didn't report, were also high 50s, high 60s. And also when we looked at variables, we saw actually that most variance was explained through the capacity variable. So in your thinking about this, is this something that you could pursue? You didn't look at it, which is fine. So that's my first question. The other one was about, linking up with what Per said, it was also mentioned that one study was looking at vaccination inclination as a form of compliance. I'm not even sure vaccination is an advisory as clearly. I think most governments say, look, we don't want to force something on you. So I think using the word compliance, I fully agree with Per, you have to be careful. Across our papers, we have changed the word sometimes to adherence when there was an advisory, or sometimes in the case in China where social distancing is not even advisory, we've just called it public health responses. And we've just called it what it is. I mean, people are distancing because they think it's safer. So I think being conceptually clear where we use compliance as a word is important. That's more of a remark, but the question I still had is for both of you, how would you, in future studies, would you think of including more of these situational variables?
Maybe first, Sarah and Thomas, do you want to respond to that?
Yes, I think it is, in fact, we have realized in our work that it's so difficult to cover all these potential influential factors. And in the end, it is always like a combination of various factors. So whether I'm like a single parent education, a person, a family in a small apartment, has to commute with public transport, cannot do home office and so forth. So it's quite challenging to include all these factors. And I think in the end, it boils down to the question whether the people perceive the solution as a potential solution for themselves. And so I think it pretty much is actually covered by this dimension of efficacy, self-efficacy, whether I can actually do social distancing. Of course, this is all influenced by many situational variables, but in the end, it boils down to the question, do I think I can do it, right? So this is our approach. I mean, it's of course, we had a bunch of all the situational information in there, but we quickly realized that this is very complex, and you cannot just include them in the regression, for example, as the direct effects. There are many interactions, there are moderations in there, and just the model would basically explode and will not explain you much more than the efficacy dimension. At least it was our impression looking at the data.
Okay, thank you for that, Thomas. Maybe before we go to the break, we go briefly also to Patricia to respond to these questions, or maybe other people from the GovTrust team who actually were the main authors of the vaccination paper. Koen, do you want to say something about that specifically?
Yes, I think my answer is a bit in line with Thomas in terms of so what we actually measured are more the motivational factors. Although we do have some social demographics which account a bit for the situation in terms of employment. What could be interesting, and therefore I think the work of Benjamin is inspiring. The survey is enormously big. Certainly for certain waves, it covered a lot of variables. We mainly focused on those variables we brought in ourselves, but there's a lot of information in the survey about how you actually feel, how your mood changed in the last weeks, how your home situation is, how actually your employment situation is. So it might be probably a good idea to check for some of these interactions and situational effects more if we basically bring in the other data. I still have, if you do it cross-sectionally, I always have a problem with, basically you can only study this across time with panel data. Because for example, feeling bad is of course, what is it cause or is it effect? Yeah? Do you feel bad because you're isolated and in the lockdown, or do you actually do not comply with the social distancing because of feeling bad? So that's one of the issues that we struggled with. In our case, we also have, basically we have two kinds of data, but we treated them so far cross-sectional, but there is a part of the data where people could actually say, well, I want to be followed across survey lines, but we still have to actually analyze this data. So there should be a possibility for some of the relationships to evaluate them as panel data. But so far, the bigger survey team, which worked with the Corona survey, hasn't yet started that work.
So thank you, Koen, for that clarification. There's also still a discussion going on in the chat, more on the values issue that was also raised by Per Lagret. I see that Patricia has already commented on that. I don't know, Patricia, do you want to say something as a final comment? And maybe then as a final comment for this panel, we go briefly back to Per Lagret to see whether this discussion about values is in line with what he was thinking when he was referring to values, because of course that can go in different directions, and it will be nice to also see what he thinks about this. So maybe first, Patricia, if you want to add something to the discussion that was going on in the chat, and then Professor Lagret, and then we go to the break.
No, I was very much aware that I was just translating his comment into our legal context, but perhaps, and I put it in the chat, the topic of the religious communities might be an interesting case to examine from a legal point of view as well as a social science point of view.
And Professor Lagret, do you want to add something as a final comment to this panel?
Well, yes, regarding values, and then I will go back to my point about meaning making and crisis communication, because I think that's very important to take into consideration when we look about the relationship between the citizens and the regulatory authorities and the government. And for example, in Norway, the crisis communication was very much asking for solidarity, united we stand, we have to work together, and these kind of arguments, instead of this top-down command kind of communication with order and instructions. So I think the way you communicate between the experts, the political leaders, and on the one hand, and the general public on the other hand, is very important when we want to understand how people comply with the rules and advices.
Yeah, so thank you very much for that final thought, and very important thought and advice basically to governments. So I would suggest to now take a break of about 10 minutes. So let's start again at 4:10. We are saving a little bit time in terms of the end reflection, so no worries. We will really try to keep to our initial schedule. So stretch your legs, take something to drink, and we will be back with the next panel, which focuses on trust and multi-level governance, and where we also have two very interesting papers and a discussant reflecting on that. So I look forward to having you back in about 10 minutes. Okay, so welcome back. I hope you had a good break. and some thinking time for the last panel and also for our keynote speech that we had earlier. So we will now move to the next panel, which is a panel on trust and multi-level governance. And our first speaker is Peter Bursens, again, one of the promoters of the GovTRUST Center. And so he is a member of the research group of politics and public governance and specialized in European integration, European decision-making, federalism, democratic legitimacy, and of course, multi-level governance. That's what the session is about. He's also a Jean Monnet chair. Peter, I see that you have already, you're already sharing your presentation. So please go ahead. We cannot hear you yet. So can you put on your microphone?
This is better?
Yes, I think
okay.
That's very good. Go ahead.
Okay, sorry for that. Thank you, Esther, for introducing. I put up my my presentation so not to lose time and to use my 15 minutes to the full extent. Thank you for giving me the floor. I will continue indeed with the presentation of in the second panel on trust. From a slightly different angle. So I think one of the things that we've seen in the previous panel is that trust was used or trust conceptualized and also measured in different ways, used to explain and to see how trust is driving behavior, such as compliance or the inclination to be vaccinated or app use and so on. What I will do in this presentation is to present some other work from the GOVTRUST consortium, which takes trust not as an independent variable, but as a dependent variable. So I'm going to present you a couple of insights on what we did when we looked at trust in this other way. So I'm basically going to look at three different questions. The first one deals with a rather institutional perspective, which looks at whether the whole response to the COVID-19 crisis had an effect on intergovernmental relations within Belgium, which assume some amount of trust between the actors within these relations, of course. Secondly, I will look at the aggregated level data from the survey that we had and we have been talking about, and look at whether citizens' trust in various levels of government differs and evolves throughout the pandemic. And finally, briefly, some words on the more individual level of trust and whether this is also varying for the different levels. So first of all, let me look at the effect of government response on the intergovernmental relations in Belgium. And again, as all papers from GovTrust, this is a collaborative effort. This is based on two papers that are well underway to be published in the coming months. So what I want to start with is the following. If we look at the Belgian state, Belgian federalism, it is highly complicated, but it has some important features. Most importantly, Belgian federalism has been meant to pacify conflicting interests, and it has done so by installing what we call the dual competitive federalism, which basically means that there are exclusive competencies. Each level has its own competencies and cannot overrule the other. And what is important to understand here is that this type of federalism more or less avoids intergovernmental relations, avoids different levels to work together, to coordinate and to cooperate. Together with this, there is a very intricate division of competencies in Belgium. Competencies are scattered, spread around different levels, and this is certainly also the case when we look at a public health sector, which is what we study here, of course. And on top of that, there is a split electoral and a split party system, which results in divergent horizontal and vertical interest and also policy. So this is the situation that was existent in Belgium at the moment that the pandemic hit Belgium in quite a hard way, has been said. So Belgium had to organize itself, and luckily there was this protocol which recognizes the federal level as a coordinating level in case of a pandemic, in the case that at the federal level, the Minister of Health, the Minister of Interior declares the federal phase of an emergency situation. And rapidly, there was a political consensus across parties and across levels that the federal level should indeed take the lead of this joint collaborative effort. So that they had to cooperate, but that they should at the same time involve all the regional levels. I will not go into how this was then organized at different levels. You will see very briefly that it was different in the first wave than in the second wave as compared to the second wave, and lots of advisory bodies. But what is very important here is to understand this composition of these bodies. This was a composition that was very much defined in a multi-level way. Not only the federal level was there in a coordinating function or position, but also the level of the regions and the communities. And the level, the decisions that they took were collaborative decisions, which means that both the, let's say, the epidemiological preventative measures and then the subsequent economic support, economic relief levels to mitigate the preventative measures, they all had an impact across levels. So they took these measures together in this intergovernmental coordinative effort, meaning that they were supported by all these levels, but at the same time, lots of these measures had to be implemented at the local and the regional level. So what is important here is, in terms of coming to intergovernmental relations, is that what we noticed here is that although the whole federal system within the whole federal system from a constitutional point of view is rather discouraging cooperation and coordination, this external shock, if you want, of the COVID crisis, of the global pandemic that also hit Belgium very hard, triggered a lot of intergovernmental relations. And in these intergovernmental relations, of course, there has to be some trust among the actors to make common measures, which indeed they did. You see here a picture of the press conferences. This is highly unusual. We see our prime minister in the middle here, flanked by the prime ministers of the regions and the communities. This is a very, very unusual picture. You would normally not see this, but this is something that was very common in the last 9 or 10 months or so. So what you actually see is that this external shock made a change in Belgium, in the sense that it was a little bit transferred from what you could call the Euro dual federalism to a de facto cooperative federalism. And this was very remarkable, although we also already countered this before. Exactly the same happens, for instance, when other external pressure hit the Belgian federal system. We have seen this, for instance, with respect to European policy making. There is a lot of dual competitive federalism in Belgium going on, but when it comes to EU policy making, de facto, Belgian levels have to cooperate. The second point that I want to make is to look at the question whether citizens' trust in various levels of government differ and evolve throughout the pandemic. Again, this is a collaborative effort from GOVTRUST work, and based on a paper that we are developing at this very moment. For this, I start, for this more descriptive interpretation, I start from Eurobarometer data, which you see here. So Eurobarometer data, which of course, and this refers to what we have been discussing in the chat as well, is based on a very general trust question. So the question that is asked in Eurobarometer is, for each of the following institutions, please tell me if you tend to trust or not trust these institutions. And what you see here is the trust by Belgian citizens in the EU and in the national government. And this is typically what you see. It involves a parallel. So what you see here is a confirmation of what we know from from the literature that there is congruence or extrapolation, so that the trust in the EU level is congruent with the trust in the national level. But at the same time, you also see here a compensation hypothesis confirmed, which means that there is low trust in Belgian governmental institutions and higher trust in the European institutions. Now, if you look at the same orange line here and you compare the trust of Belgians in national government and trust and with the EU average, then you see something very peculiar happening here at the in the summer of 2020 in the pandemic, whereas the European average of trust in the national level increases, it decreases in Belgium. So this makes Belgium an interesting case to look a bit into more detail in. And therefore, we use the data that we have from the Corona survey from the University of Antwerp. So what you see here is we plotted in this graph here the evolution of the pandemic with two peaks in the spring of 2020 and in the fall of 2020, and the dotted lines are the trend lines of trust in federal government and trust in the EU as measured in the survey. Now, important here is that this question was specifically geared towards whether respondents trust the different levels of government with respect to the way that they deal with the pandemic. So let us look into more detail what is happening here. So first of all, what you see here is initial high level of trust in the federal, regional, and local government levels, a parallel evolution of these levels until the end of June. So clearly what you see here is a rally around the flag effect. Initial very high trust in the national levels of government, and people relate to these national levels of government to deal with the crisis. Secondly, what is very interesting in these data is what you see here is that there is a sudden rise in trust in the local level. And this happened at the moment that local levels were being enabled by the federal rules to take additional preventative measures when needed. And this happened in August, and very specifically in the province of Antwerp, which was at that moment hit very hard by rising infections. And we controlled this by looking only at the Antwerp respondents, where we saw the same. The third thing that we noticed in these data is that a bit later on in time, the federal level becomes much more trusted in comparison with the other levels, which you see here. And this happened in our measurement in October. And this we can clearly relate to the fact that finally, after 1.5 years, the federal government was formed, and this federal government swiftly changed direction of dealing with the pandemic. Where in September the caretaking government was still quite relaxed about the measures, the new government very much turned into much more preventative measures. So what we probably see here is that our respondents evaluated these preventative measures, renewed preventative measures in a quite positive way, which you also see here. And this is on the bottom right, where respondents were asked whether how their trust feelings changed over time. So where in most of our waves, people in the majority of the respondents said that they had less trust than in the weeks before they were answering the survey. Suddenly in October, it was the other way around. Finally, the European level, which follows very neatly the other levels. Trust in European level follows very neatly the trust in the other government levels, which we can see as a confirmation of the congruence effect. But not of the compensation effect, because measured by this question, at least the European level is trusted less than the Belgian level. So to sum up a couple of remarkable conclusions here. In times of crisis and measured again as we did, we see congruence but no compensation between the national and the EU level. We see an initial rally around the flag effect for the domestic government levels. And we think that we can also see that preventative measures are evaluated positively and trigger trust in government, especially in those levels of government that are responsible for the measures. What we want to check for in the future is effect of media attention, especially the difference between the European level, which is active to a very large extent, but more or less behind the scenes, and not directly taking measures that affect businesses or citizens, but facilitate, enable other levels to take these measures. So we think that therefore Europe is much less in the picture, and this might also have an effect on people tending to trust this level. To end with, I think I have just 1 or 2 minutes left. My final question, very briefly, which we started looking into very recently, is the question whether at individual level we also see this variation in trust in different government levels. 2 things that stand out here and I think are important mentioning is, and because they confirm what I said just a few minutes before, is that what we see at the individual level is that the more measures are perceived effective, the more government is trusted. And this is the most important factor to explain trust, more in the federal level than the European level. And what we also see is that the more measures are perceived appropriate, again, the more government is trusted. Again, only for the federal government, not for trust in the EU, which is obviously, I think, also related to what I just said about the visibility of the European level and the type of measures that are taken by the European level. We have more data and conclusions on this individual level of trust. I can maybe come back to that in the discussion. More variables that indeed have an effect on trust in different levels. But I leave it here so that we can have sufficient time for the other participants, presenters, and maybe come back to this in the conclusion. Sorry for going over the time.
Thank you for that, Peter. No, you stayed almost within the time, also with a lot of different papers taken together. There are already some comments for you in the chat, so maybe you can already look at that while we first move on to the next paper of this panel, which is Domenica from the University of Twente. So she's a Marie Curie PhD researcher in the Plato project on post-crisis legitimacy of the EU. And her PhD is on political trust towards different levels of government in times of crisis. So it's clear that she's very well positioned to be in this panel. I see that your presentation is already up. So Domenica, please go ahead. You have the floor. Maybe we first check whether we can hear you well, and then I will be off.
All right, can you hear me?
Yes, excellent. Go ahead.
Perfect. Thank you for this introduction, and thank you for the opportunity to talk to you today. I would like to show you some preliminary results of the study that we conducted last year in the Netherlands with my colleagues from the University of Twente, with Dr. Guido Jansen and Professor Bas Denters. So what we had was survey on citizens' perceptions of the COVID-19 corona crisis and governmental responses. We also asked a lot of questions about people's socio-political attitudes and the civic behavior during the crisis. And because the project was co-financed by the Dutch Ministry for Interior Affairs, we already produced a few reports which are available on the website coronapapers.nl. So what we did with our survey study is we created a panel which consists of 3 waves. The first wave was from the beginning of April, the second wave in the July, the third recent from the mid-December, right before the Christmas break. And for what I want to show you, especially with regard to the changes in trust levels, is very important to consider the context of these 3 waves. So when we look at the timeline, the first wave was collected, the first survey was collected very soon after the intelligent lockdown took place. And the corona crisis and the corona pandemic was a very new thing to everybody. Then towards the end of April, Dutch government announced relaxation of some of the measures, which were steadily coming into force before the summer break. And then summer is the period of time with the most relaxed measures. Actually, when we collected our survey in July, many people didn't even believe there would be a second wave of the pandemic. So that's interesting to have in mind. And then autumn, as we know, brought another wave of the pandemic, and then the restrictive measures were slowly introduced. And on December 15th, the Netherlands went into something which was not anymore intelligent lockdown, but a total lockdown. And of course, it was announced some days earlier. And when we collected our survey, that was the first day when the total lockdown came into force. So I would like to show you changes in some of the, so what we asked people was the standard trust question. So how much trust do you have in the following persons, institutions? And the blue bars show the results from April, orange from July, and pink from December. And what we can see is that people trusted the most doctors and nurses and scientists, a little bit less Prime Minister and Dutch government, then the local level of governance, so mayor and local government, then politicians, then European Union was about the score 4, which is, I would say, neither trust nor distrust. And then people were much more critical towards trustworthiness of media and religious organizations. So so what we need to consider here, I think, is the two propositions of trust in crisis. And the first popular proposition is the rally around the flag effect that was mentioned earlier, which claims that the external, and I want to emphasize here, external crisis, such as the health crisis, this pandemic, brings a boost, temporary boost of trust, of support for the governmental incumbents, so they can deal with crisis, I guess, more effectively at this point. But then there's a second proposition which says that the crisis should be draining these resources, these trust reservoirs. So we should be observing a steady decline in trust as the crisis progresses. But what we see here is that, well, in April, trust in various institutions was quite high. Then in July, it was lower, as per the proposition of a crisis decreasing trust levels. But then again, in December, we can see again the rise in trust. And this is the case for most of the institutions that we asked about, except for the national level of governance, so except for Prime Minister and Dutch government. And this is one very interesting finding, because what we can see is that trust in Prime Minister and the Dutch governance, the cabinet, actually stayed quite high throughout, and even increased towards the end of the year. So that's one very interesting finding. The second interesting thing is that trust usually is very highly correlated with evaluations of performance. So the better perception of performance of various institutions, the higher should be the levels of trust. So, but when we look at evaluations, how the evaluations of institutional performance changed, we can see that actually across the board, in case of almost all institutions that we ask about, except for the European Union, we see that the evaluations were slowly getting lower and lower, whereas the trust had followed a little bit different trend. So that's very interesting. And then when you consider especially this trust in Prime Minister and trust in Dutch government, and compare it with the evaluations, we can see that people thought actually much less positively of the corona crisis related performance of the government, and yet they trusted the government more towards the end of the year. So, and yeah, similar trend goes for the local government. Although one thing that I would like to draw your attention to is that it seems like the evaluations of the local government, which I will show also in more detail in a second, remain quite stable throughout. And I think this has to do a little bit with the composition, multi-level composition, governance composition of the, or structure in the Netherlands, right? So the Netherlands is much more centralized state, especially as compared to Belgium. And the corona crisis management was performed mostly at the national level. Although, of course, the local governments took an active role in implementing many of the measures, still the way it was communicated to the public, and much more attention was paid to what government does and what prime minister says. So that's why you can see that we ask about the evaluations of 5 different dimensions of the performance. So whether people thought that the government was quick to respond to the virus spread, that the government knew what to do, that the measures were effective, that the government did what was best for the people, and that decisions were clear and transparent. And again, we can see the much bigger variation in the evaluations of the national level of governance rather than local. And yeah, so I think it has to do with much bigger exposure of the national government, which could be taking both praise and blame for the corona crisis management. Then just to compare, these are the distributions of answers to our trust questions. So we use the 7-point scale. And what we can see is that the trust in the national level institutions and local level institutions, they're both a bit skewed to the right. And when it comes to the trust in the persons, right? So prime minister is a one-person institution and mayor is a one-person institution, is higher than trust in the collective body. And this is also something that is quite visible during the crisis, that people tend to trust more strong leaders. And then that's why I guess this boost, this confidence boost went mostly to the leaders of the government rather than to the government as a collective body. In the what Peter showed for the Belgian case, right? So that usually trust in the EU is highest in Belgium, and trust in federal government is somewhat lower in non-crisis times, so before the corona crisis. Well, in the Netherlands, what we usually found was that people trust the most their local officials, they trust less their national officials, and they trust the least the European Union. And whereas the European Union is still in the last place in this trust competition, we can see that the crisis changed the dynamic between the local and the national level of governance. So usually people would trust more their local government, but during the crisis, all of a sudden they started trusting much more their national governments rather than local officials. And yeah, the frequency of responses, the distribution of responses, you can see that in case of the national institutions, they are more skewed to the right, whereas the trust in the EU is much more evenly distributed. And when it comes to the European level of governance, we were also quite interested to see what happens with people's support for the European integration. So we know that Dutch people in general are not so fond of deepening of the European integration. And we wanted to see if maybe crisis is changing something in this respect, that being faced with this huge external threat that maybe could be better dealt with at the European Union level would change people's minds in this respect. And what we can say is that that was not the case. So Dutch are quite stubborn and not trusting the EU so much and not wanting more integration, even if some of them say that, well, I guess it would be more efficient to deal with the threats at the European level. So, yeah, so I think that what is remarkable in the Dutch case, and I would be really interested to see how does it play out in other states? But what is quite remarkable in the Dutch case is the relative resiliency of political trust. So even though the crisis on it still is on the unprecedented scale, and it affects the lives of individuals to such an extent, and it's been going on already for so many months. We can see that even the changes in trust that I presented to you are actually not that quite big. So we can see quite high resiliency of political trust in the Netherlands. And in our further research, we want to explore exactly why that would be the case. So probably that has something to do with the societal level factors. So perhaps this has something to do with how the Dutch society is, with their social trust, with their solidarity, with their civic orientations. But on the other hand, it can also have something to do with the way the corona crisis is being managed by the elites, with the way their crisis management is communicated to the public. So there are the societal level factors and elite level factors, and probably the interplay of these produces this resiliency of political trust that we can that we see here. And I prepared much more, but I think that this is enough of food for thought for the moment. And thank you for your attention, and I'm looking forward to the discussion.
So thank you for your presentation, Dominica. It's very nice to see the two presentations next to each other, Belgium and the Dutch situation. And it will also be interesting to see how this has been changing, because of course, last couple of months, a lot has happened in the Netherlands. So maybe you can also later on say something whether you plan to do a next wave of the survey and whether you have any ideas about that. But before we go there, we now have our discussant, our second discussant, which is Francesco Palermo. He's from the Institute for Comparative Federalism from the University of Verona. And so specialized in comparative Italian and European constitutional law, of course, in federalism and in European integration. And so also an excellent discussant for this panel. So Francesco, I hope that you're ready. You said you had your comments prepared, but not using any PowerPoint. So once you're ready, please go ahead. You have the floor.
I am, and thank you very much. Let me first start by congratulating on the establishment of GOVTRUST, because it seems that the topic is really highly relevant, and it is challenging, especially for lawyers who are normally not used to deal with trust as a legal phenomenon. And I think this is deeply wrong, and the papers have also demonstrated how relevant all these issues are for including legal research. Well, let me start with a more general comment, and then I come to the issues related to the multi-level organization of countries. The more general element I want to raise is that especially the lawyers among you might be familiar with what is named the dilemma of Böckenförde, so named after the German constitutional lawyer Ernst Wolfgang Böckenförde, who said that the liberal democratic state rests on principles that it is not able to safeguard. Because on the one hand, it can exist as a liberal state only if liberty and freedom, which are its foundational value, regulate themselves and are not based on imposition. Because if the state tries to guarantee liberty and freedom by sanction and coercive measures, then it fails to remain a liberal state. Well, I guess this is perfectly applicable to trust as well, because trust is an essential element for the working of a constitutional system, but it can hardly be imposed, because if you impose it, then you undermine trust, and it's a vicious circle. So the topic is very relevant, and also the papers have confirmed that it is extremely relevant also in terms of constitutional theory, because after all, constitutional law really rests on implicit paradigms and elements, underpinnings that must exist in order for a constitution to function. Maybe this goes for law in general, although of course it seems to me that we had a discussion earlier about the difference between individual and collective in compliance. I don't want to go deeper into that, but of course it seems easier if there is a system which imposes sanctions that can be then implemented, and when you need a trust to make a collective polity to work. Like, of course, you can impose a debt to be paid even by force, but you cannot impose, let's use a Belgian example, to form a government, for example. And Professor Van Rooij showed that there are limits, and it is difficult actually to impose behavioral modifications. But okay, this would take us a little beyond the scope. And I am supposed not to talk only about constitutional theory, but also to deal with one specific aspect of constitutionalism, which is federalism and multi-level governance. Well, here the question is whether institutions and constitutional arrangements can promote trust, which is the fuel to make the constitutional engine work. And looking comparatively, we can actually notice different approaches and different responses. We've just heard the very interesting presentation by Peter Brussens on Belgium, but in general, I think it seems to me, at least, that responsiveness of the institutions and of the political process play a fundamental role. Or if it is not the responsiveness, it's the perceived responsiveness. The presentation by Friemel and Geber was very interesting in that regard between effectiveness and perception. But okay, just a few more inputs to come to an end on whether the presence of more actors increases or decreases the chance for trust. And of course, I don't have definite answers, but just a couple of inputs for further research, perhaps, from especially a point of view of comparative federalism. So the first one is, which levels of government are more trusted, right? And we heard the last two presentations were very focused on that, and really they provided a lot of food for thought. It seems that overall, the lower levels are more trusted, and in federal multi-level systems, definitely more than in unitary states. So I'm not sure it is by chance that, as Dominica showed, in the Netherlands, the central government is trusted more than local governments, and in Belgium it is the other way around. It might be a perception by people. It might be because the lower level just agree to entrust the national level with all the powers, as in Belgium and in many other federal countries. But it is something very relevant, I think, also for decision makers, and this is something that should be taken into consideration. And I think also that trust studies, which is what you are doing, should consistently be disaggregated in providing information between federal and unitary countries to see if and to what extent federalism is an engine for trust. A second point of reflection is that in most federal systems, governments in responding to the pandemic have not resorted to emergency legislation. So they did so much less than in unitary systems, which I find also an interesting element of reflection. It would be interesting, again, to link this element with the measurement of trust, so whether the declaration of a state of emergency improves or lowers the trust in government. And finally, what about the effectiveness of the COVID-related decisions in federal system? Is it higher or lower than in unitary states? Again, difficult to measure, but it has been argued. I have read some research done by others, especially based on the comparative observation between Switzerland and the United Kingdom, that actually there are some factors of multi-level arrangements that can contribute to giving greater chances for positive practical outcomes in terms of crisis, which is especially the mutual learning and institutionalization among the levels of government, the celebration of differences, etc. And this is in the end, I think, the old debate about the preconditions for a effective federal system, but in general, it seems to me that the stronger the cooperative culture and the cooperative institutions, so the intergovernmental relations, the better a multi-level system works and can be also an asset, also in terms of creation of trust. It would be interesting also here to disaggregate data on trust based on the type of territorial organization. Okay, so just some inputs that came to my mind also when listening to the presentations. And like other speakers, I have no final conclusion, at least not yet. So a lot remains to be done in terms of research in the area, and I'm very happy to be following your research on that. Thank you so much.
Thank you, Francesco. Of course, your task was also not to coming up with answers, but to make life difficult for our panel members. And I think you did very well with the input that you provided. So Peter and Dominika, who would like to go first in giving some feedback? And in the meantime, others can, of course, also raise questions in the chat that we will then put to our panel members afterwards.
I can start if Peter doesn't mind. Great. So I wanted to refer to one part of the discussion presented, which is about if the federal government, how the multi-level structure affects the distribution of trust across the multi-level governance, meaning like in unitary versus federal states, do we have more trust at the local level? Or not, and why that would be the case? Well, there's a very old argument about the size and democracy, which says that in the smaller units, the democracy just works better and it boosts people's trust in the governmental officials, right? So according to this, we should see more trust in local government officials rather than in national level. But then, so what happens in the Netherlands is that there's a very high, usually outside of this COVID crisis, usually there's very high trust in local government. But the local governments in the Netherlands are also quite strong compared to other Western European countries. So yeah, I would have to still wrap my head around especially the Belgian and Dutch comparison, because in the Netherlands, of course, then we do not have this federal, this division, right, into two very powerful units and then the local level. In the Netherlands, it's rather the local versus national, and then in between there are some other also organizational units who are just not so so important. So I'm curious to hear what Peter would say.
Yes, speaking on this very briefly, maybe. Yeah, I agree with Dominika. There is indeed the the argument, also the empirical evidence that lower levels of government are trusted more than higher up levels, but it doesn't seem to apply in times of crisis in the same way. And that's this rally around the flag effect that indeed you see at the start in the initial phase, but then, and as also Dominika finds, because this is very similar in the two countries, right? I mean, there is initial very high level of trust in the ones that can take care of the crisis, and then it decreases. So probably there is something going on in terms of I also think visibility of who takes the measures. which, as I said, also partially explains, I think, why the EU is kind of at the lower end. It's not visible at all, although very much active, but not visible indirectly and taking measures that are directly affecting citizens, only enabling others to take these measures. I'm intrigued by the last point Francisco was talking about, the effectiveness of federal states, more effective than others, and of course, which type of federal states. And I do agree with this idea that cooperative federalism probably is more effective, and this I think is close to what I've been trying to say, that in the facts, what happened in Belgium, although it's not cooperative at all, they were forced to cooperate because of an external pressure. I'm not quite sure that that this is really the big explanatory factor, because if you look at Germany, for instance, we all thought that Germany was doing so well, at least before the summer, but then after the summer, it's the same type of federalism. It has not changed, but it did not do that well compared to before the summer. So there is much more going on than just the type of federalism, I think. But I do agree, and this would be an interesting project, I think, is to really go into the type of federal states and see how they took care of the response. So that might be one of the other things that we, among the many things we still have on our plate, that we can look into. But thank you very much for these comments.
Right now, I don't see any further comments in the chat. Dominica, do you want to say something about plans for future surveys, especially in view of the recent developments, the riots that have been happening, and of course also the fact that the current Dutch government is no longer fully in charge because of other problems, and how you think you would take that into consideration then in a future survey?
So unfortunately, we have to deal, even though our ambition would be to, of course, to continue and carry on, there are always the budgetary restraints. So I'm afraid that's it when it comes to our data collection on this topic. And when it comes to very recent developments regarding Dutch government, I see here on the participant list so many Dutch colleagues. I think they are in a much better position to talk about it than me.
So I guess that's an invitation. Is there any Dutch colleague who wants to respond to that invitation, who wants to take up that challenge and say something about the trust in the current political climate? I fear that nobody wants to take up that challenge. Maybe then another question that is a little bit related, and then we can move on to Koen, unless there's still somebody else in the panel who wants to say something. In terms of methodology, so in the former panel, there was the issue of how you phrased the trust questions, and were the trust questions more focusing on the corona crisis and the response to that, or were there did you have distinctive questions in terms of generalized trust and more specific ones, like we also had them in the Flemish survey? And also for those who are interested, also Bjorn Kleijsen commented in the chat on some of those issues. So Dominica, can you also say something about that in terms of the survey that you did?
Yeah, so we used what is referred here to as the more general trust questions. So basically, how much trust do you have in the following persons, institutions? Because our reasoning was that, well, in the current context of the corona crisis, it's difficult to imagine that people would be able to detach it and will respond to the trust question while not thinking of what was going on right now. We have, what we opted for instead is a detailed list of questions about the evaluations of performance in various aspects of the corona crisis management. But what we saw in the previous studies, for example, studies that were conducted during the economic crisis, so also this crisis context, is that usually if you ask few questions about do you trust government to be competent, to be effective, and so on and so forth, usually the correlation is extremely high in answers to these questions. I don't think that people meaningfully distinguish between them. And well, our study was also to kind of, so what we wanted to do is we wanted also to compare levels of trust during the pandemic to those from before the pandemic. And then, of course, if you ask the very precise question about the corona crisis, then you have the issue of it's difficult to relate it to the results that you had from before the crisis, which was the more general trust question. So that was a bit more of a path dependency, considering the data we already had from before the crisis, and that we wanted to continue and be able to compare and see how the situation develops. I think that there's a very long list of advantages and disadvantages to this approach, and to the approach of choosing the very precise question, the question that GovTrust used, right? So trust in relation to the crisis. Yeah. So it just, I guess when interpreting the results and when talking about them, it's just important to emphasize exactly what kind of question you asked, because then it has implications a little bit for how you understand the results.
Yeah, so thank you for that clarification. Francisco, Peter, is there anything you would like to add to the panel before we move on to Koen for final reflections? No? Peter?
Maybe, yeah, very briefly, I completely agree with Dominica. I mean, the type of question you ask is extremely important. We know from methodology papers also that there is a priming effect. But I think, but Björn actually is implying in his answer is that the fact that there is a crisis going on, which is so dominant, is a kind of a meta priming effect for whatever question on trust that you ask these days in whatever survey. So we have to be very careful and at least mention very carefully that this might be going on, and mentioning indeed what kind of question that we are asking. So
yeah, so thank you, Peter, also for that final comment. So Koen, let's move back to you for some final reflections, and then conclusion by Sophie op de Beek. Koen, you have the floor.
Okay, thank you very much. I will keep it very short because basically we are almost using up our time, or we have used up our time. So maybe, first of all, thank you very much for all the presentations and all the contributions and discussions we had. I thought they were very insightful. I will just name a few things that I would take myself, and hope you agree with them, or you take other points with you. But I thought the emphasis on this kind of holistic approach, also taking into account the situational factors, which was mentioned by Benjamin, together with this context specificity of compliance, studying compliance, which I think we also see further on in the presentations. The balancing of interests that Patricia mentioned, preventive measures in relation to economic, social measures, which during time in the crisis had a different way for people to assess. The role of experts, besides the role of media in crisis communication, which was both stressed by Thomas and Sarah and Per. Thomas and Sarah also emphasized the importance of social norms, which links to social contagions in the studies that Patricia discussed. Per and also Patricia focused also a bit on legitimacy. Patricia said that the shortage of input legitimacy can be compensated by output legitimacy, also throughput legitimacy. And Per asked the question how capacity for governments to deal with the crisis actually links with this legitimacy, to what extent there's a relationship. The element of time, so several of the studies actually follow a process over time, and maybe we should do more with it in terms of this regulation phase, deregulation phase, and re-regulation phase. That was a very good comment of Per, and I know that David Levy-Ford also has a strong interest in these kind of dynamics. When it comes to the second part of the day, this kind of evolution in the two countries with the different constitutional setup, where Peter showed that although we have a de jure competitive federalism, we were forced to work together in a cooperative federalism, but also the difference between the different evolutions in trust at the federal level and EU level, and that there are different institutional explanations, but also at the individual level, there are some differences in how people perceive trust or would explain trust towards federal level and EU level. And Dominica, also thank you very much. I thought certainly the difference between Belgium and the Netherlands is quite striking, because you had some kind of constant trust in the national level, where in Belgium it fluctuated much more, and it basically also followed almost peaks we have, which is a kind of a strange evolution. What I also noticed is that although the trustworthiness dimensions decreased over time, for some actors, trust was U-shaped, which is very interesting to dig into. And then Francesco, thank you very much for your observations, how indeed the question whether or not federal systems could deal better with these kind of crisis situations and increase trust more. It's very interesting to explore this kind of mutual learning, celebration of differences. And maybe I should end there. I think the studies had a lot of commonality, but also a lot of differences. And basically it's a celebration of the differences of the studies we have here and how we can learn from each other. So this mutual learning is certainly clear here. And also I like this kind of interdisciplinary talks we can have through this forum. So thank you very much from my side. I thought it was very stimulating. I hope you will attend next year. Probably we will organize this every year with other empirical data and theoretical debates. But thank you very much for all the participants. Thank you very much for all the speakers, and thank you very much for all the discussants. I give the last word to Sophie, who would like to conclude.
Yes, thank you. Just a quick word of thanks. First of all, of course, to our presenters and discussants. I want to express my appreciation for your insightful and very stimulating and inspiring presentations and discussions. I think we were fortunate to have a very wide range of speakers from various fields. So on behalf of the whole GOVTRUST team, I want to thank you for the time and effort it also took to share your findings and experiences. To all the participants, a big thank you for attending, of course, this first symposium of the GOVTRUST Center of Excellence. I hope you found it informative, valuable as well, and that you will join us again for future events from the GOVTRUST Center of Excellence. Feel free to reach out to us, of course, for further information or to reach out to connect. And last but not least, have a good evening, morning, afternoon, wherever you are in the world right now. And we will gladly see you next time. Thank you.
Thank you so much for organizing.